County Supervisor Nathan Fletcher joins us here on Newsradio 600 KOGO. Sir, how are you? Nice to talk to you.
I'm good, Sully. How are you?
Good. So I'm going to ask you this. I'm just going to ask you this straight out because, first of all, kudos to you for being a leader here because you have shown leadership. I can't say enough good things about how you stepped up and were sort of the guy on this. I have to ask this, though. The scenario that the Board of Supervisors voted on a few weeks ago that aligned the county's public health officer, Wilma Wooten, the county's chief medical officer, 20 hospital partners out of the 22, the sheriff, the mayor, all in concert in what looked like a prudent, safe, reasonable plan, it wasn't a garbage plan. It wasn't an open up everything plan. It was a sort of a really measured plan. You voted against, and I have to ask. I wouldn't be doing my job if I didn't ask you why those opinions weren't enough to convince you to vote in the positive direction for that.
Well, there was a couple things in there. The majority of the things that were in there, first off, it wasn't an actual reopening. It was just sending a letter to the governor to say we wanted to do it. So it was symbolic, but symbolism is important. And there were a number of things in there that I felt comfortable with. There were things in there that didn't cause me that much concern, particularly the outdoor things, sport fishing, youth sports. There was a number of things on that list that I thought we were in a good position. There were just some other things in there I didn't think it made sense to do immediately. There was a provision in there for churches at full capacity. I think that is a problem, right? My church that I am active in is not a building. We have a building, but it's a group of folks of shared faith. Our church has been strengthened, but I think we see real concerns around the country with those. Some things like movie theaters. Again, when you're looking at the highest risk things, these are indoor, high intensity, high exposure. They're the things that are most likely to trigger outbreaks, and I think it is important that we do this in phases. I also think, Sully, there's a difference of opinion. I support a phased approach where we take a responsible step. We have a little bit of time to measure the impact. We take another step so that if we end up in a situation with a spike or a serious thing, we have a greater ability to point to or know what it might have been. And so I continue to be on the side of responsible reopening. I do think compared to many of my colleagues, think we ought to go a little bit slower. And that is not out of a desire to impede our economic recovery. It's my perspective on this is that the most important thing in our economic recovery is that it be smooth and consistent. And if you go back to 1918, and it's not 1918, but when you don't have pharmacological interventions, meaning a vaccine or a therapeutic treatment, you're left with non-pharmacological interventions, things like physical distancing, closing things, face masks. And you go back to 1918 and you look at the jurisdictions who did not move early enough, and they had significant first waves. They overwhelmed their healthcare system capacity. They had hospitals overrun. They had significant deaths. But they managed, when they came out of that, to do it responsibly and in phases, and they didn't have as much a second wave. The other jurisdictions in America who did what we did, which is we moved early. We moved before we had exponential growth, before we had spread. Almost every one of them came out too fast, too soon. That triggered second waves, which triggered the reimposition of closing down things, and that would be the worst possible thing for our recovery. And so I continue to stand by the thing that is in our public, not only our public health interest, but our economic interest, is that we do this responsibly. We do it in phases, and some of these higher risk activities, we're opening bars on Fridays, and I'm not against folks going out to bars. But the reality is those are the types of settings that are most likely to trigger spread, and those are the types of things that I'm just a little comfortable waiting a few weeks longer to get to.
Let me ask you this. And by the way, Supervisor Nathan Fletcher joins us here on Newsradio 600 KOGO. Obviously 2/3 of the restaurants in this county have closed, and unfortunately, when things like this happen, the same thing happened during the Great Recession, and I've called this the Great Repression here because we had to close this economy. I don't think there was another. I have to agree with you. There was another way to do it, but. Look, at 2/3 of restaurants aren't going to open back up either. There's going to be some attrition here. And what do you say to those people that say, look, had we been able to, open differently or have a different phased approach, let's say mid-May versus mid-June because things look like they were as stable back then as they are now. What do you say to those folks as far as their futures and how do you mitigate some of those decisions that were made maybe in haste in months past? And look, I will give you, out of an overabundance of caution, I understand that. But what do you talk to these guys, these people that are small business people that are trying to survive here in San Diego?
Well, I don't doubt in any way Sully, I don't discount at all the very real economic burden that this has brought on people, and the devastating impacts we've had, particularly, in restaurants, you operate on thin margins anyway. That's a hard business to be in when times are good.
Sure.
And so to have to close down and do it is bad. I guess the question is, had we not done what we did, what would the impact have been? And we don't really have an example because nowhere just said, well, we're just going to kind of keep everything going and see what happens. I think the one that gets held up the most often is Sweden. Sweden did not close as many things down. They certainly closed a lot down. And you just saw the architect of Sweden's fund come out and say, look, it was a mistake.
Well, listen, stand by right there. I'm going to keep you over for just a second. I won't keep you long. But Nathan Fletcher, County Supervisor, joins us here on Newsradio 600 KOGO, giving a real clear picture of what his intentions are with respect to opening the economy. Welcome to your weekend. Supervisor Nathan Fletcher joining us here on San Diego Business Weekend. And Supervisor Fletcher, one of the things you just mentioned, of course, is Sweden may have opened too quickly. Here, and I get emails all week long, and as you do too, and phone calls. One of the issues here talks about community spread and personal responsibility, right? Which I believe is sort of the metric behind still wearing face coverings and so on and so forth. Even though, I have to ask the question: when did we go from let's flatten the curve to we need to disseminate or decimate this? I mean, we went Old Testament on this curve, and suddenly we went from we got to flatten the curve to we have to have a vaccine or something like that. Is it your position that we will be wearing face masks in this county, and we won't go to a phase 4, which probably means concert and sporting events, until there is a vaccine?
Yeah, so let's walk through that. The initial aim was to flatten the curve, and the aim of that was to preserve the integrity of the healthcare system. The whole goal, if you go back and you watch everything we talked about, was we had to flatten the curve so that we did not overwhelm the health system capacity. We successfully did that. The other thing that we did during that time frame while we were doing that was it allowed us to build up our testing capacity so that we could have rapid availability of testing. In the early days of this, we were doing a handful of tests a day. Now we're doing close to 5,000 tests a day. That testing is a vital component because if people can rapidly get tested, we can say you're positive, you need to isolate. Then we contact trace, we talk to your close contacts, we test them. If they're positive, they isolate. And that helps us in this containment model. And so it's the thought process moving forward is that we want to contain the spread. We're not going to stop the spread. As we reopen and people move around, it's going to spread. But we want to contain the spread to preserve the integrity of the healthcare system capacity. So if you look at ICU beds, we don't want to run out of ICU beds. We have hovered between 64 and 71% occupied in our system ICU beds. We can live in that range. That's fine, but only if we contain the spread. And so efforts around physical distancing, hand washing, face covering, temperature checks, those are kind of the four corners of the individual actions we hope folks will take in conjunction with rapid testing and tracing, and that those two will allow us to reopen almost all sectors of our economy, but manage the spread in a way that we can stay below health system capacity so we don't overwhelm our healthcare. And I will tell you, Sully, that if you have a breakdown of your healthcare system, you're not going to have a very healthy economy.
Well, no question.
So,
I'll hand you
that. We have to do that.
My question, though, is do you maintain that before we can remove facial coverings in this county specifically, and before we can go to phase 4 for sporting events and let's say concerts, I know there's a few other things, but those I think are the main things that stand out. In your opinion, do we have to have a vaccine?
Well, the governor said that, state of California-wise, not in terms of face coverings, but in terms of those really large gatherings where you've got 20, 30, 40,000 people, particularly in indoor settings, that he doesn't see us getting to that until we have either a vaccine or a therapeutic treatment. But I think, another point that I'm reminded of daily is every day we learn more about this virus. It is a novel coronavirus. It was more responsive than a lot of folks thought to the stay-at-home orders in terms of slowing the spread. We did a phenomenal job in San Diego in those initial phases, and we continue to learn more. So I think we'll continue to learn more about asymptomatic transmission. We'll continue to learn more about indoor versus outdoor. And as we continue to learn more, because it is a new virus, then we'll have to continue to adapt what we do. My whole aim is to make sure that we can have as smooth and fast a recovery as responsible, but that means we got to continue in that reopening posture. And look, we've done great in San Diego, and that is a testament to the individual folks in San Diego. And Sully, I've said this 100 times that I trust that businesses care about their employees and they care about their customers, and that they're going to, by and large, the vast, overwhelming majority are going to follow the guidance, and that's why we're in a good position. But, you also just look around the state. You got 10 counties that are now under state monitoring because they've had spikes in hospitalizations or transmissions. You got Ventura County that doubled their COVID hospitalizations between Friday and Monday. Orange County's seen a 25% increase. Arizona's having real problems. And so, again, the aim is to reopen and get our economy going. We just don't want to throw away all of the sacrifice that was made to preserve the integrity of the healthcare system by doing it recklessly. And so I think we just have to be mindful as we go forward. It's easy. Sometimes I like climbing mountains, and the majority of mountain climbing injuries solely are on the descent because you hit the peak and you think you made it. And the reality is the dangers of this are still out there, and they're still as real as they were in February and March. Now we're more aware of them. Folks are more aware of physical distancing and washing their hands, and we have much greater testing capacity and tracing capacity. And those are the things that we're counting on to help us literally wrestle the spread, contain the spread to a manageable level. And we can handle some increase. It's not there can't be any increase. Of course, there's going to be some increase. We just want a manageable increase so we don't overwhelm the healthcare system. And then the last point I want to make, too, is the number of cases is irrelevant. It is the percentage of positives relative to total percentage of tests. We are much more aware of positives now because we're doing much more testing. Sure. It doesn't mean that it's getting that much worse.
Nathan Fletcher is our guest. I appreciate you being so generous with your time. I got one more question with you. I don't have much time on it, but I wouldn't be doing my job if I didn't ask this. People ask me this all the time. We have civil unrest going on for a good reason here in this country, in this county. And it's valid that people are exercising their First Amendment rights to peaceful protest. But the 400-pound sort of problem in the room is the fact that enforcement is not the same for protesters not wearing face masks as it is for some small businesses, funerals that they can't attend, so on and so forth. In your opinion, I know this is not your edict, but in your opinion, why do you think there's a disparity there? I mean, it feels like we're being a little inconsistent.
No, I get that, and some folks have been, Sully, but I'll tell you, I've been consistent on this. It was, a month and a half ago, we had a lot of protests surrounding reopenings. People wanted to reopen, and they wanted to reopen it all right now. And I did not ideologically agree with those protests, but what I said was that is their constitutional right to gather and protest, and I hope they do it as responsibly as possible. And now we see a group of protesters who I may more ideologically agree with what they're protesting, and I said the exact same thing that I said when it was a different group of folks. That's their constitutional right, and we hope that they're as responsible as possible. And so that's where we have to go. And there has been, throughout the duration of this, there has been uneven enforcement. I was very critical early. I had a constituent of mine who was a part of a car protest at Core Civic, the private prison. They weren't violating any public health order. They got pulled over in their car and written a citation for honking their horn as a part of a protest. And then 2 weeks later, we saw a bunch of folks in Encinitas and Solana Beach, and they didn't get ticketed for doing it. And so, I think throughout this, law enforcement has a difficult job in terms of enforcing public health orders. I think some areas have enforced them stronger and that type of thing. But at the end of the day, we're never going to enforce our way to compliance with these public health orders. We just hope that folks understand that this isn't, no one likes telling people not to go somewhere, and no one likes telling people to wear a face covering. We don't like any of that. What we're trying to do is ensure that we can reopen our economy, we can get our schools up and running, we can get things going in a way that protects public health. And from my standpoint, wearing a face covering when I'm around non-household members within 6 feet is not that big of a sacrifice for me to feel like I'm making in an effort to know that might save someone's life and help us. And I realize people disagree on that. But again, the things that are put in place are temporary things, and they're temporary things that are designed to allow us to reopen.
Nathan Fletcher, County Supervisor in San Diego's 4th Supervisor District. I really appreciate you being so generous with your time. I hope you'll come back with us. You can also hear Nathan here once a week on the San Diego Morning News as he updates us on COVID-19 and the county's response, so on and so forth. So Nathan Fletcher, once again, thanks so much for your time on that.